Well, as we go through life, we all pick up scrapes and scars along the way, but when those scars are on your face, the damage may not only be physical, but emotional. Dr. Mona is here now with a guest to talk about new procedures that can help heal those scars.
So Dr. Thomas, you're the head of the Department of Ear, Nose, Throat, Head and Neck Surgery at the University of Illinois. And I understand the University of Illinois is now developing a Center for Excellence in Revising Facial Scars. Can you tell us about that?
That's exactly right. We want to have a center where people with facial injuries that end up in scars have a place to go with a full team to work together with them, both for surgery aspects and post-operative care, skin care, all the aspects to make that scar look the best for those patients.
I sometimes have patients with darker skin, myself, more olive compared to you, which is right, exactly, more Caucasian, white, peaches and cream complexion. Is there a difference in removing or treating the scars in different complected patients? Because I think that darker skin patients are more likely to develop what we call keloids, which is a raising of the skin. Is it harder to do surgery with those patients?
Definitely, those keloids, which are big lumpy scars that we've all seen in people, tend to be more frequently in darker skin patients. It can be in anyone, but it's more frequently with those individuals. And there are also pigmentation changes of the scar itself that we have to deal with. Again, we mentioned the laser, that's sometimes helpful. There are different specific treatments for the lumpy scars, the keloid scars that we use in those individuals. Again, ranging from surgery, there's some medications that help that are injected there. And we also more recently are beginning to use radiation therapy locally for that in combination with surgery as well.
What we'd like to do now is actually take a look at some of the surgeries and facial scar revisions that you've done in the past. Let's look now here. This is a photograph of a woman who was in a motorcycle accident. Can you tell us what you did with her to improve her? I mean, it's a vast improvement.
You've seen that poor person a variety of scars and really facial deformity. And one thing I will say in regard to that is scars on the face are really different than scars you might have somewhere else. You don't want a scar any place, but something that might be acceptable to your hand or your body, if it's on your face, is a much different impact on you in terms of the psychological feelings about that. And this poor person is a good example of that. So this individual, you see scars on the forehead and cheek and around the eye, and she's had a variety of surgical techniques followed up with the dermabrasion and the sanding sorts of things that we've done. And over about 6 or 8 months, then you see the final result here, which looks much better. And on that patient, I might point out that we didn't fix the scar by the eye here, and you can see the difference of an untreated scar area with the other areas here and how much better they are.
We've got a picture now of a woman who had probably some kind of skin cancer or some kind of lesion removed from her skin and then ended up with a scar, and we see you revise that. Can you tell us about that?
Yeah, so you are right. Most of the skin cancers are in the head and neck area, so for facial plastic surgery, that's where we're working all the time. And you need to have those removed, often with surgery, but unfortunately sometimes the scars are not acceptable. So that's another big group for us in the Scar Center to be able to revise those scars, and as you see here, get that person back where they feel more comfortable. And really the scar in this case I think is less noticeable in this older individual than maybe their normal lines and wrinkles that they have here. So that's our goal. The face makes such a big difference in terms of how we feel about ourselves. So
absolutely. Self-esteem goes way up, I guess, if you do what you've done in some of these pictures.
Part of what's happening.
We thank you so much for being here. How can people get more information about this new Center of Excellence at the University of Illinois?
Yes, well, 2 ways. First, you can call 312-255-8812, or our website is www.thomaschicagoplasticsurgery.com, and they can link to all the other aspects of the things that we do there.
Wonderful. Thank you so much for being here and for showing us those really, truly magnificent pictures. Back to you, Craig.